This is Emily Walker, MedPage Today, reporting from Congress, where the House Energy and Commerce Committee, Subcommittee on Health, held a hearing Thursday on the sustainable growth rate. Members on both sides of the aisle are in unanimous agreement that the SGR needs to be scrapped. I spoke with Dr. Cecil Wilson, who's an internist from Winter Park, Florida, and president of the American Medical Association, about his ideas for how to get rid of the SGR and what to replace it with.
We are delighted that the Health Subcommittee of Energy and Commerce are holding these hearings on moving forward with Medicare payment reform. The challenge is that we have a formula that determines payments that is broken and faulty. It needs to be ditched, and that's the purpose of this committee, is to hear innovative ways about how to reform physician Medicare payment system.
Wilson explained the AMA's plan for Medicare payment reform.
Get rid of the SGR, that formula that's not working. The second is to put in place a 5-year period of stable payments. In other words, provide updates to meet the cost of providing care, but a 5-year period of stable payments that physicians can count on. And then the third is to use that 5-year period to develop alternative approaches to the Medicare system and to providing care and paying for care. A variety of things like accountable care organizations, the patient-shielded medical home, virtual or partial capitation, gain sharing, bundling. These are some of the things that are on the table.
But every practice or hospital would not have to adopt the same reimbursement model, Wilson said.
Models will vary based on geography, based on culture, and based on practice patterns, and we believe that physicians and patients need to be able to choose among a variety of models.
The witnesses at the hearing, many of whom are doctors, all supported the same plan. Get rid of SGR, test out new models for 5 years, and then implement those models. Members of Congress are also sick of the SGR.
Members of Congress on both sides of the aisle and in both houses of Congress, as well as this administration, are unanimous in agreeing with us that this system needs to be fixed.
But members of Congress have long been saying that, so what's the difference this time? I asked Wilson.
The encouraging thing, I think, is that instead of doing what we've been doing for the last 10 years, and that is saying block the cuts at the end of the year, we're saying we need to look at new models, different models. So we're headed down a different track. So everyone is in agreement we need to change course. We're going to look at some options, and so I'm encouraged by that process.
From Congress, this is Emily Walker, MedPage Today.